Doctor, I don't want my face to look frozen. First thing my patient will come and tell me whenever we have a discussion about the botulinum neurotoxin or tox. Now, why do we do Botox and why should people consider doing it? It is not only about aging. Let's burst the myth. It is not only about aging, because lines which are caused on our forehead, on our crow's feet, smile lines, those are not only because of aging, those are by the overuse of some expressions. And also in high stress individuals, sometimes you would have seen that some people have a habit, even if they are looking at the phone, they will have this expression on their forehead. Now that is not because of aging, that is the habitual thing which they have become used to of doing again and again. By constant movement of the muscles of expression on the face, there constantly becomes lines due to constantly relaxation and contraction, and those are the lines which are called as dynamic lines, which are not there when you are rested, but when you make an expressions, you can see those lines. These are the things which can be treated by Botox. There are other things also where Botox can help, like in migraine, people having issues with very tight muscles at the back and constantly getting recurrent migraines, Botox helps. Hyperhidrosis, constant excessive sweating in the palms and the underarm area, Botox can help very well. So these are the areas where also we use Botox. Now, coming to this, how and where and when you should start getting Botox, it depends upon the genetic factors, upon the aging factors, and upon the skin. What is the type of the skin? Some people, because of the genetic factors, start getting these lines very early in their life, like in their early 20s or late 20s also. But usually these kind of dynamic lines are seen usually about the late 20s, where due to the overuse you will see crow's feet lines here, the M pattern, these lines, and then there are other smile lines which are seen in this area. So how does Botox work? Tiny injections of Botox in the skin. So face has around 42 muscles. In those, 20 muscles are used to give the expressions on the face, and they are the different muscles which pull the face and give the expression of smile or of the weeping expression or sorrow or fear or everything. Now it is very important to inject the correct muscle with correct dose of Botox. Can be only done by the person who is qualified to do so and has a proper knowledge of the anatomy. Now these Botox, the small doses are injected in the muscles which are overacting, so it kind of paralyzes or decreases the activity of that muscle, so that when you are expressing, those muscles are not moving so much, and that's how one thing you treat the dynamic wrinkles. Second thing is you prevent further wrinkles from happening because you are reducing the overactivity of that particular muscle. Where people go wrong, I am sure you would have seen on YouTube videos also, you open and there will be asymmetrical eyebrows and there will be a frozen smile, frozen look on the face, where even if they are crying, it does not look like they are crying, or when they are happy, it does not show on the face. So I will tell you, the right way of doing Botox is not taking away those expressions and giving you the frozen look. The right way of giving Botox is to decrease the activity of the muscle to the limit that the expressions are still seen, but it does not allow the over expression happening, so that it does not cause any kind of unnatural lines or effects on your face. So the Botox are given very commonly for forehead relaxation, for the eye area, and also for the smile lines. There are other reasons why Botox is given. Sometimes one part of the face is asymmetrical. Many patients are there where one side of the eye will be high and one side will be low. So to correct these also, Botox are given. What can be the complications? If given properly or improperly in the muscles which are not antagonist and they are injected at a wrong place, people can have drooping of the eyelid. The eye becomes very small and they are not able to open. That is one complication of Botox which is not given properly. Another thing is drooping of the margins of the lips, where the smile is not helping. Even if they smile, the lips margins are drooped. Third thing is, when they smile, the lips don't move, so it doesn't look like they are smiling. These are the areas where people go wrong when given a wrong dose or wrong plane of injection or wrong muscle is injected. So it is very important to get it done with a qualified personnel who knows what they are doing and not fall for the cheap tricks like getting Botox in the salon just because somebody wants to make money and they make you sure that they will do the right job. Find first if the person who is giving you that is qualified enough to do that, because remember, it is not a salon procedure, it is a medical treatment. Some people also have the habit of very tightly biting their teeth, and because of that they have always pain in their teeth and the enamel of the teeth, it grinds. So always they will be like clenching the teeth very tightly. That is a painful situation. In that also, this muscle which is called as the masseter, when you keep your finger here and you bite, you will see this muscle getting hard here. Giving Botox in that area relieves of that pain of biting the teeth very strongly, which is called as bruxism. Changing the shape of the face, yes. Especially in many males, I have seen this part will be very big and they will be slightly unhappy with that. So giving Botox in this area also slims the face so that their face looks more proportional and more softer. So these are the uses of Botox in which we give Botox, and it does not give you a frozen look. So you should know whom to take with and which age the Botox can be started. So it is not a permanent procedure. It stays for around 5 to 6 months, and after that the effect starts coming down. Now it also depends upon person to person. Metabolism is high, Botox will go fast. Metabolism is normal, Botox will last longer. So typically around 4 to 6 months it starts, and then again you will have to redo it if you want to redo it. If you don't redo it, people say that will it go worse? No, it will not go worse. It will still remain the same. And actually it will prevent those 6 months of wrinkles from happening. If you have static lines, which even if you are sitting at rest and you see the lines, those will not go with Botox. There are other ways of treating those lines, like putting fillers or skin boosters. So I hope I have answered few common questions about Botox. If you have more questions about that, feel free to message and I will be happy to answer. Don't forget to like, share and subscribe the video, and I will be sharing more such videos which are informative for you in the upcoming time. Thank you.